Hello everyone, thank you for joining us today to our latest Queen Elizabeth Scholarship webinar. Those who are joining us here in the room at the McMaster Health Forum in Hamilton, Ontario, and those who are joining us online, we appreciate you coming out and supporting our scholars. A little bit of an agenda for you before we get started. I will tell you a little bit about the forum. I'll tell you a little bit about our current Queen Elizabeth Scholarship Program and then our new Queen Elizabeth Scholarship Program, and then I'll introduce you to our two scholars who will each do their individual presentations. The Master Health Forum here in Hamilton, Ontario, McMaster University is the leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders and act as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program here at the university is run by a partnership between the Rita Hall Foundation, the Community Foundations of Canada, Universities Canada, and Canadian universities. The purpose is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. The forum's version of the Queen Elizabeth Scholarship is the Strengthening Health Systems program. Our scholars contribute to strengthening health systems and become part of our large and growing network of health system leaders. We also now have a new Queen Elizabeth Scholarship Program here at the Forum, so we are proud to be selected as one of 20 institutions to host the new round of scholars. It is expanded in scope in terms of what we are looking at, so the name has changed slightly, so we are now the Queen Elizabeth Scholarship Program in Strengthening Health and Social Systems. This new program is very similar to the old program with a few subtle differences. So the location of the internships has expanded beyond Commonwealth countries to include low and middle income countries. Our partners have expanded to include those in such countries. So specifically we have new partners in Colombia and Lebanon. We have a new focus on social systems as well as health systems. We have expanded the eligibility programs here at McMaster, so that includes arts and science. And the number of opportunities has decreased. So because of the funding of the new program, we were only able to offer half as many scholarships as we were able to offer in the original program. A long list of scholars from our original program. There were 61 in total. Our two presenters today are from this group. Here's our first cohort of scholars who went away or visited us primarily in 2016. Our second cohort primarily went away or visited us in 2017. And then our third cohort, or last cohort in this original program, was primarily went away or visited us in 2018. Our two scholars today come from this cohort. I'm pleased now to introduce our next presenter. Gareth, at the time of his internship, was also an undergraduate student in the DHIS program. He has an interest in nutritional research, including healthy eating, food security, and foodborne illnesses. This directly actually influenced his work during his internship at CARPHA, where he hoped to not only increase his understanding of the nutritional field, but also to learn more about the impact of health policy on improving the health of individuals globally. So please, let me introduce you to Gareth.
Thanks, James. Today I'll be discussing my internship at the Caribbean Public Health Agency in Trinidad, and this occurred in my final year of undergraduate in the fall of 2018. So here are some pictures that I took in Trinidad. On the right, that's sort of an image of the Caribbean Public Health Agency with the sign outside of it. Some of the other pictures were taken throughout Trinidad. The one on the left is a picture of the port in Port of Spain, and that's the capital of Trinidad. There's also another picture at the boardwalk where a lot of people would go fishing. Some of them would catch red snappers, they would catch pufferfish and things like that. On the bottom left we have a picture of the bamboo cathedral. That's essentially a lot of bamboo that hangs down and it kind of makes a formation of a cathedral. And last there's a picture of a coconut. I enjoyed a lot of coconuts during my time in Trinidad, and that was really fun. And lastly there's a picture over there of Maracas Beach. So about my internship in Trinidad and Tobago, it was a focus on nutrition and health, and I was working with the Surveillance Disease Prevention and Control Division under Ms. Christine Bocage, who's a senior technical officer. And we also have, I also did this in my fourth year under the Queen Elizabeth Scholarship that provided the funding for a 3-month internship, and I'll be talking more about, first of all, more the academic side of what the projects I did, and then at the end I'll be talking more about a couple of pictures that I have to share with you. So to give you a brief snapshot of what I did was essentially the internship was sort of broken into 3 parts. The first one was in September, and I was primarily working on a policy that hopefully will be used by 26 Caribbean countries to address the agricultural health and food safety concerns in the Caribbean region and to strengthen food safety and food security. Secondly, I worked on a policy, in October I worked on the District Health Information System, or DHIS system, and what I helped to create was a nutrition surveillance system, and hopefully this will help to increase the data collected on children within the Caribbean region at the child health clinics around the region. And lastly, in November, I was working on a nutrition surveillance bulletin, and the purpose of this was primarily to take this pre-existing data from various organizations such as the World Health Organization to create a bulletin to be understood by stakeholders, and it will also be used in the future to inform future bulletins and act as a framework. And so I'll be now going into sort of the details of all these 3 projects sequentially. So the first project was, again, a agriculture, health, and food safety policy. So here's sort of just a picture of what it sort of looked like. So the purpose of it was to combine agriculture, health, and food safety, and it used more of a holistic approach or a One Health approach to addressing the concerns in the Caribbean region, addressing not only human or public health, but also plant health, animal health, and environmental health. So there's a really comprehensive sort of policy. And so essentially the objectives were to improve, to ensure that the food in the Caribbean was food security, and also food safety standards were in place to ensure that any foods that were imported or exported from the Caribbean would be safe to consume for individuals. And lastly, it was to, again, improve a little bit on the surveillance of animal and foodborne diseases. So a little bit about the contents of the policy. I first went into sort of the legal and institutional frameworks in place, talked about some of the trade agreements in place in an international, regional, and national policy context to provide an overview. Next of it was the public health, looking at the measures to ensure food safety and security. What are the shared responsibilities of distributors, food handlers, and producers, as well as laboratory testing, so sampling programs and law enforcement. Next was looking at the animal and plant health, the holistic approach to animal and plant health, looking at food safety inspection and as well as enforcement. And lastly, environmental health, so air and water quality, natural disasters, and invasive species. So some of the skills that I learned at the Caribbean Public Health Agency was, first of all, collaboration and teamwork. So first of all, working with the team to develop a policy with various individuals from, for example, the Pan American Health Organization, which is a regional office of the WHO, the World Health Organization. Working with, for example, someone from the CEO of the Caribbean Agricultural Health and Food Safety Agency, and I was able to receive feedback from not only my supervisor, but also received feedback from others and learned to integrate these suggestions into the policy. Next, I vastly improved my knowledge in the area of the nutritional landscape. I was provided with a lot of readings from my supervisor that were very helpful to understanding the nutritional landscape, and I was provided with some of the policies that were existing in place to help inform the current policy and provide a basis for that. Thirdly, I would say I learned to work more efficiently and under pressure and tight deadlines, and I found this to be a very useful skill. And lastly, I was able to use some of the knowledge that I gained in health policy in the third-year health policy course in the Bachelor of Health Sciences program by actually collaborating with others to help to produce a policy. And so those are some of the skills that I learned from doing the first project. Moving on to the second project, this had to do with the District Health Information System. So the District Health Information System is a system used in over 60 countries that are governmental and non-governmental organizations. And this is to serve a variety of functions, from disease surveillance to monitoring outbreaks to tracking patient health and increasing access to data. And so what I primarily worked on was a nutrition surveillance system to help improve the current system to collect data and monitor it on a local and national level. And so the purpose is that this data is already existing. It's already at the child health clinics throughout the Caribbean region, but this system is more to centralize this data so that it can be used to inform whether that be research or policy or things like that. And I collaborated with various individuals, and I used the cancer registry data collection forms to sort of provide me with a framework of what the collection forms could look like, and I received support from the statisticians and biostatisticians. So to go a bit through the World Health Organization Child Growth Standards, essentially these standards are used by the WHO to classify people based on various different factors, so sort of like a BMI. And so, for example, let's say you take someone's weight and you divide it by how old they are. In the second column, we can see that it would tell you if someone is underweight, if they have, for example, a Z-score below -2. So there are many different ways of categorizing people based on different measurements, and so this can tell you, are people obese, are people overweight, are people stunted in their growth. And using this, what they do in the Caribbean region is that they have child health clinics. And at these child health clinics throughout the Caribbean region, what they do is they have these tally sheets. And these tally sheets, what they do is they will record, healthcare practitioners will record how many people, for example, have obesity in this sample chart would be in a particular age group. So for example, how many people have you seen in your clinic that are less than 12 months old and are obese? So then they would sort of tally this. And the purpose of this is to record how many people are obese so that they can actually survey in the Caribbean how many people are obese. And then moving on, in terms of monthly, so what they do at the end of the month is they take this data and they put it on another sheet and they collect this for different areas and for people of different age categories. And so this will allow them to have a better understanding of the obesity status or any other factors within the Caribbean region. And so this is sort of a screenshot of what some parts of the system were like. And so, for example, we have at the top the reporting form. That's sort of a standard form that they use, which country is reporting this data, what year is this data being collected in, and then what reporting period is it? So what EPI week is it? So is it week 1 to 4 in the year? Is it week 5 to 8 in the year? And so using this, they're able to keep track of how many people fall into different categories within different times of the year, and so it's quite important. And so we see here, for example, let's say we take January, and we're looking at how many people are overweight or obese. Let's say there are 100 total cases, and there are 50 males. What this form does is it removes the burden or the effort required by healthcare practitioners to do all the calculations. By simply inputting the raw data or the numbers, it will calculate, for example, how many % of cases are male, or various other calculations. So another sample one would be, for example, in January you have 100 cases, and in February you have 150. Well, what this form also does is it calculates a cumulative total. So for example, by the time it's February, as we can see on the bottom right, we have 250. So what it will do is it will add these together, and it will provide a running total so that people don't have to do so many calculations. So this is just sort of a sample of what this can do. And so that was only for obesity, and this is sort of a screenshot of what are the other indicators that we're looking at. So core and extended WHO and nutritional indicators, what else are they looking at? So for instance, it could be the amount of children and adolescents who are wasted. How many of them are severely wasted, stunted, severely stunted, underweight, severely underweight, overweight, at risk of overweight, and obese. In terms of other indicators that are collected by the form, it also includes the number of children and pregnant women with anemia, the number of infants with early initiation of breastfeeding and exclusive breastfeeding at 6 months, and lab burst less than 2,500 grams, less than 4,000 grams, adults with a BMI between 25 to 29.9, and BMI greater than 30. So this form essentially will take a lot of information, and it will allow us to better track different factors, nutritional indicators. So we don't have to go into all of them, but that's sort of what the purpose of this form is. And so going into some of the skills that I learned from this, the first one is more so to facilitate data collection and calculation. So analysis of data, how do we integrate different functions into a data collection form. I also improved my knowledge of nutritional landscape, so understood what are the WHO child growth guidelines, what are the core nutritional indicators, and lastly, I learned how to design health information forms, so how can they be produced, and I also learned that. And this form will now be used by a consultant to ensure that it's compatible with the district health information system, and hopefully it can be used within the system to collect data from the Caribbean to better understand all these different factors in improving the data in the Caribbean region. So lastly, the last project I worked on was a nutrition surveillance bulletin, and this is the inaugural bulletin. So this one will be used as a framework for the future bulletins produced by the agency. So on the right, that's sort of a picture of the paper. We have an introduction at the beginning, then we go into what is the nutritional status in the Caribbean region, then I talk about the infant feeding practices, and lastly, the food situation. So the energy intake, the protein intake, the fat intake, and sugar intake, among other factors. And so essentially the purpose is to provide educational information to stakeholders, as well as translate the facts and figures into a bulletin format that can be accessed by a wide audience. In terms of the framework, it will be used for a framework for the future bulletins that will hopefully be generated on a semi-annual basis, and the data will be populated from data collected from countries to populate the bulletins. So whereas what I did was I used data from the World Health Organization from, for example, the UNICEF mixed survey, that which is a multiple cluster indicator survey, which collects data on different factors, and this data is sort of collected by these agencies rather than have it be reported directly from the child health clinics. And that's sort of where this project links into the second project that I did, which was improving the data that's collected from these child health clinics. And so, as we can see, this is a screenshot that of a table that I produced that was from the World Health Organization Global Nutrition Monitoring Framework. This is the, for example, the status of the amount of people who are overweight. And so, as we can see, there's no data on a lot of countries, and even for some of this data, it is reported on different in different years. And so this could be problematic if we're trying to understand the situation in the Caribbean region. And as well, different standards use different age groups. So for example, the WHO uses a standard that classifies people based on ages 0 to 5 and 5 to 19, whereas the Global School-Based Health Survey would record it from age 13 to 15. And so it's hard to compare data if the age groups are different and the data is collected from different years and using different surveys. And so that's sort of the challenges and gaps that we're running into while obtaining this data, and we knew that going forward, and that's why the second project was carried out, to better collect this data, which is already there. This data is already there at the child clinics. The only thing that needs to be done is for it to be centralized, and so this would vastly improve the understanding of the obesity situation in the Caribbean region. And so this is the last slide I'll be talking about more the content of it. These are just some of the, for example, some of the facts and figures that I pulled out from the paper. We have here, for example, the sugar intake in the Caribbean region. So as we can see, the light blue line is sort of, that's the food goal, that's the population food goal. And a lot of the countries are above that for sugar intake, except for Haiti. And as we can see, some countries such as Trinidad and Tobago are quite high, I think over 3 times the recommended amount. And so it's important to reduce the sugar intake. There are other key facts and figures that I pulled out, which was, for example, anemia. A lot of the countries had about 30%, but Haiti had about 50%, which was quite elevated compared to the other ones. In terms of obesity in school children, approximately 30% were overweight, and Bahamas had the highest. And lastly, stunted growth. From the statistics that we found was Haiti had about 21.9% stunting in 2012. And so to go on to a little bit more of my experience, I've included in the next couple of slides some pictures. So this is one, this is called a bacon shark. It's sort of a cuisine in Trinidad that a lot of the tourists or people go to at the beach. And so it tastes really good, and they put a lot of additional condiments that you can add on to there. That's from Richard's Bacon Shark. That's one of the more popular ones to go to. On the left, that's a picture of the Canary bird swamp, and it's essentially a bird sanctuary where they provide boat tours, and you can take pictures of some of the national birds, the scarlet ibis, and they also run fishing tours and things like that. So that's more of a nature getaway type thing. On the right, that's a picture of some plantain chips. I think those were homemade, and those were sort of on the way to go to a beach called Maracas Beach, and that was sort of on the top there, and they had a really cool lookout point there. That's more of a picture of Maracas Beach. As you can see, there's beautiful sand, and that was you can't tell it in the picture, but it's very hot there, very sunny, and there's nice clear water there. And that's also at the top part. That's another picture, another angle of Maracas Beach, and as you can see, that's sort of the more outside, more where the tides are a little bit bigger. And at the bottom, we have a picture of the boardwalk, the Chaguaramas boardwalk, which is a nice place where people can go and stroll around. And so that's pretty much it. The picture on the right is a picture taken outside the Caribbean Public Health Agency. That's just the sort of everyday scenery, which is pretty cool. And that's a picture of me outside the lookout point, and that's it.
So thank you all for joining us today for our Queen Elizabeth Scholarship webinar. We have lots more webinars coming up in the future. If you're interested in our Queen Elizabeth Scholarship program, the first link that's on the screen there takes you to the information page where you can learn about the scholarship and how you can apply. The second link is a link to all of our presentations and webinars that are upcoming, so please join us again. And the third link is to our blog page that our scholars write blogs regarding their trips. So feel free to read a little bit more detail about some people's trips, more personal insights. That's all available there. So thank you again for joining us. Thank you to our Queen Elizabeth Scholar presenter, and we'll see you again soon.